Hello and welcome again to another edition of Health Matters. And it's good having you back on this platform. Tonight, we have another interesting topic, and we will be discussing men's health. Today, we have with us in studio Fasia Hilton that will be, discussing that topic with us today. So wherever you are, I encourage you to share the video, invite someone, and be part of this information section. So Fasia, you are welcome tonight or afternoon or wherever the rest of our people are. You are welcome, Fasia. Can you hear me? I can hear you. Can you hear me? I can't hear you, Fasia.
Thank you. Thank you.
Yes, I can hear you now. Welcome to Health Matters. And tonight, our audience, we want to say
Loud and clear.
good. Thank you for joining us. Today's
Are you
Health
hearing
Matters.
me?
I can hear you. I hear you.
Can you hear me?
Yeah.
Let's see.
Yeah. Okay, so we just want to go straight into the
Thank you.
program. I know we kind of the internet is kind of lacking a little. So bear with us as we continue this program. I want to call our sister tonight, Fasia, and she's going to introduce herself. So you are welcome, Fasia. Oh, this is okay, Fasia. What we're going to do here, people, we're going to allow a little time so Fasia can go off and come back in because we have this.
Thank you. Thank you for having me on your platform this evening. Good evening, everyone. My name is Fasia Hilton. I am a proud Liberian and alumni of Cathedral High School. Are you hearing me?
Yeah, we can hear you. Fasia, let's do this. We're gonna have Fasia back. We want her to adjust her microphone and do all the technical thing in the background because we having a little lacking there in our internet. So she's gonna be right back. Meanwhile, tonight promised to be another wonderful night. Tonight we are talking about men's health. There's this statistics that tells us that women live a little bit longer than men. So we want to know the reasons, some of the reason why women live longer than men. And you're going to hear some things that, you need to hear to prepare yourself, to keep yourself healthy. And the purpose of this broadcast is to create awareness and to give you information on what you need to do if you are experiencing some signs and symptoms of different illnesses. I'm not a medical doctor, and even our guests we bring on, they are in the medical field, but they are not your healthcare practitioner, and you need to seek the help of your doctor. You need to seek the help of your primary physician. You need to seek the help of your primary physician on everything concerning your health. Whatever symptoms or however you feel, you need to go to the healthcare facility and look into the situation. We are providing you information. We are providing all the awareness so you can be aware of the signs, things that are happening to you. Be more aware of your body. We are not telling you this is the solution, but we are helping you that when these things are happening to you, you will know a little bit of what is happening. Because when you go to the hospital, they're going to run series of tests. And at the end of the day, your doctor will tell you exactly what it is that is wrong with you. So I urge you, I encourage you, whatever information you hear, always seek final advice from your doctor. Fasia, you are welcome again. I know we have a little, lacking in the internet on your side, but nevertheless, we are here tonight and we're going to provide the information that our people need to know. So welcome. Welcome. I can hear you, Fasia. Can you hear me?
Thank you.
Okay. Go ahead, Fasia, because we have this thing going on with our internet. So I would just allow you to, go ahead with the presentation tonight, and so that we be able to flow properly. Yes. So
Thank you. Thank you. Are you
so I
hearing
want.
me?
Yes, I can hear you. Now we are talking about men's health tonight. I want to know, and our
Can
audience
you hear
want to
me?
know. Yes. What is men's health?
Hello, hello, hello.
I can hear you.
Yes, I can hear you loud and clear. Oh, you know what? Hold on. Are you hearing me now?
Yes.
Can you hear me?
Yes, I can hear you, Fasia. You are okay.
Is the volume okay? Can you hear me?
Yes, you are okay, Fasia. Go ahead.
Okay.
We are talking
Yes.
about what is men's health.
Well, men's health, according to Levant and Pryor, men, men's health refers to the state of complete physical, mental, and social well-being that is experienced by men or infirmities. Okay. So, okay. Can I go ahead? For some reason, the network is really bad. There's a little bit of lag in time, but I'll go ahead and just start the
Yes,
presentation.
go ahead.
Again, what is men's okay? What is men's health? Men's health refers to a state of complete physical, mental, and social well-being that is experienced. Yes. So this is a complete state of physical, okay? And it is not only the disease process that we're talking to women. All right. And I would just give a little bit of statistics here. Men die 4.5 years earlier than women. Black men die 7 years earlier than white men, which is a very, and then also men are less likely than women to seek medical care. I wonder why. Did you guys know that? Medical care than women, because they feel like going to the doctor is not a masculine thing. It's not for men, it's for women. You know, so, and then also men they are heavier smokers, they are heavier drinkers, they choose unhealthy and risky behaviors. Okay. So I will of death amongst men. I won't speak about all, but I will speak about the most common and the most severe ones.
Yeah.
So when we talk about what are some of the leading causes of death, vascular disease. Another one is diabetes. Another cause is the big C, cancer. So one might say, well, when you talk about, there's an umbrella of several diseases that falls under cardiovascular disease. Can I go on? Are you getting me?
Go on. Go on.
Hello?
Go on.
Are you getting me?
Yes, go on. You are talking about the leading causes of death amongst men.
Yes.
So go on.
So like I said, there are several diseases that falls under that umbrella of cardiac. You know, that's the high blood pressure. We talk about cardiovascular disease. That's when they have a stroke. We talk about peripheral vascular disease. You know, it's not functioning well, it's not flowing well. And then we talk about congestive heart failure. Also, this is congestive heart failure. And then you start to have shortness of breath. All right. But out of this cardiovascular disease, I will dive a little bit on high blood pressure. And
okay.
Yes. So like I said, the leading causes, the first, then you have cancer. So I will target on those three. All right. And then I'll also talk about men's sexual health. I know most of them want to know about that. All right. So with the cardiovascular disease, we will dive into high blood pressure because that's the most common. That's the one most people know. Now it's the silent killer. Why? Because the blood vessels, the arteries don't get the symptoms until things gets really killer. And with men, they do not like to take their medications as well when it comes to their high blood pressure. And one of the reasons for them not wanting to, they don't like the side effect of that blood pressure medication, which is the erectile dysfunction. But I will get to that later. Okay. Another leading cause of death is diabetes. And diabetes is when your pancreas is not the cells. So I'm not going to go into the in-depth pathophysiology because I know you have people coming on to this. I'll try to speak in layman's terms instead of you I'm talking about. All right.
Yeah.
So diabetes is an issue with your pancreas. Your pancreas is not in a cell so that it can pump it into your bloodstream to lower your blood sugar. All right. And so there are some numbers that we look at to diagnose a person with diabetes. And the American Heart Association says 1C, that's an accumulation of the blood sugar for 3 months if it is 6.5 or higher, or if you get a fasting blood sugar of 126 on 2 consecutive tries. Okay. And then there's also something that we call pre-diabetes, and that is if their blood sugar is 5.7 and higher to 6.4, then we'll put you in that category of pre-diabetes. And these are all these high blood pressure, diabetes, they are all detrimental to our organs.
Yeah.
And one of the major thing, and these are diseases that can be treated with medication, with lifestyle modification, but the patient has to follow the instructions, their medical provider instruction. They have to take their medicine. They cannot say, oh, I'm feeling good today, so I'm not going to take my medicine today, or I'm not going to take my blood sugar today, or I'm not going to take my blood pressure today. Like I said, remember I said blood pressure, we label blood pressure as the silent killer, because you feel fine and you go about your business. You don't want to take your medicine. You don't want to take your blood pressure medicine because of the side effect or because of what you hear your friends telling you what can happen when you take your medicine. Instead of you going to your doctor to talk to them and ask questions, patients listen to other patients.
That's right.
What they are saying about what side effect they are experiencing. Just because that patient is experiencing certain side effect doesn't mean you are going to experience that same side effect. Okay. So, and then we will go into
so I know
diabetes.
We are so Asia. I know the internet is kind of lacking a little, but I wanted for you to tell us what are some of the signs they ought to watch out for in cardiovascular disease. What are some of those signs, those symptoms that they need to watch out for?
Okay, with high blood pressure.
Yeah.
Okay. Most times they will have headaches. They will have severe headache. Or sometimes in a position, they might feel lightheaded. That means your blood pressure is too high. Or sometimes when it gets worse, they can have chest pain.
Okay. Wow.
But again, remember, high blood pressure is kind of tricky because most times the heart is a muscle. So it's working overtime to compensate, to make sure that the blood is flowing. Because that heart is a muscle, it is because it's a muscle.
Yeah.
Okay. So your heart is just like any other muscle in your body. Like for men, those that are bodybuilders that goes to work out, you work out and do bench presses, and you get these muscles in your arm gets bigger. It's the same as your heart. If your heart is overworking, it's going to get bigger. And then there's another condition that we call cardiomegaly. That is enlargement of the heart. So the key here is for men to make sure that they are going to see their doctors routinely, so that labs we can detect these diseases early.
That's right.
Where we can do something about it, either with medications or lifestyle. Okay.
Okay.
So the third cause of death in men is cancer, the big C. And that's the one we are all afraid of, that big C. We don't want to hear that word. Okay. There are over 310,000 cancer related death in America. So over the course of a lifetime, 1 in 2 men and 1 in 3 women will develop cancer. I will dive into a few of the cancers that are prevalent in men. You have the prostate cancer. You have the lung cancer. And then you also have colon cancer. That's the cancer of the polyps in your rectum. Okay. So now with the prostate cancer, and most of these cancers, all cancers can be, if you are screened. But if you wait and don't go to your doctor, then there's no way we can screen for it. There's no way we can detect it early. There's no way it can be treated. So if you don't go to your doctor in time and you go late, then it might be too late, because then when we do screen and detect it, it's at a stage 4 where we can't do anything about it. And one of the reasons why men don't go to the doctor is because of that. So men over 40, when you are 40 and above, that's when your provider, meaning your primary care doctor, need to be a nurse practitioner, a physician assistant, a medical doctor, or a doctor of osteopathy at age 40. And one might say, what is the prostate? The prostate is a little walnut shell gland that is in your rectum that we check. If you go to the doctor every 3 months, then we check it every 3 months, but at least it needs, depending on how often you go to the doctor. But for me as a provider, when my male patients come to see me every 3 months, I check the prostate, because within that 3 months span, something can happen.
That's right.
Yes. So, and one of the reasons I speaking to my male doctors, my male patients, they tell me, they say one of the reasons why they don't like to go to the doctor is because of this prostate cancer. And also they prefer female providers than men providers because of this prostate check. There is a lab that we check for your prostate to make sure that it is okay, and that lab is called a PSA. Okay, it's a prostate specific antigen. It's a protein that is released by the prostate, and we check that level. And our normal level should be 0 to 4. So if I check your PSA level, which is pertaining to the prostate, and that level is high, 4 or higher, I will send you to a urologist to check to make sure that everything is okay.
Okay.
And so there is a manual exam that we do on the prostate. Manual meaning I will check the prostate with my fingers. Okay. And men, they don't like that. Okay. Another type of cancer that men are prone to is fatal cancer in American men. And most of the cases of lung cancer is due to cigarette smoking.
Okay.
Yes. So for those who smoke, you are at a higher risk of developing lung cancer. And also, if you have a family history of cancer as well, then that puts you at risk. I am not saying that a person who does not smoke cannot get lung cancer. They surely can. but the risk is minimum. Okay. And so with the lung cancer now, your insurance pays for yearly screening. If you are a smoker and you are age 50 and 50 to 79, your insurance will pay for it. That is part of your screening package on your insurance. It should be free. And that is done yearly. And this is what I do now is lung cancer. That's my specialty right now. I used to do primary care before. Now I do lung cancer.
Okay.
Okay. So
we'll continue with our slides.
the other type of cancer is the colon cancer. And that is checked in both men and women. And it begins at age 50, where your doctor will send you to the stomach specialist, the GI doctor, and then they will order a colonoscopy. And that's where they will give you, a drink that you would drink the day before. You would start maybe around, 4 o'clock the day before, and you would drink it all through just to clean your bowels. So it's like for those of us, for Liberians, it's like taking, dosalt. I'm sure you all know what dosalt is, but in layman's terms, it's like you're taking dosalt to clean out your system so that when it do go in, there's no feces in there, there's no stool in there. They can check and see. Okay, that is done at age 50.
Yeah. Okay, we'll go to the next slide. Yeah.
Go to the next slide. Okay. Yes. So we'll talk about the sexual health. Your sex life is a reflection of your overall health, believe it or not. The healthier you are, the better it will be. So when you do go to your doctor for your yearly screening or escort, make sure you ask your doctor to check an STI panel. Even if you know that, hey, I'm fine. I don't run out. I don't run in the streets. I'm fine. There's no harm in getting that checked. So STI or STD, that those terms are used interchangeably. So STI is sexually transmitted infection, and then STD is sexually transmitted disease. So same thing, where they will check for trichomonas, for gonorrhea, for chlamydia, and then also they can check for syphilis and what have you.
Okay.
Because studies have shown that if you sleep with one person, okay, that means that you have slept with 7 other people. If you sleep with 2 people, I think the number quadruples to like 24 people. If you sleep with 3, it goes to 64 people you've slept with. And that's how the number triple and triple. Yes. So make sure I do it as a routine. I will tell my patients, you're here today. Is it okay for me to do, an STD panel? It doesn't hurt.
That's right.
I work in public health, so I know what happens out there. You might be doing the right thing, but the other partner, you don't know what they're doing. Please, I am not accusing anybody. I am just speaking from a medical standpoint.
Yeah. Yeah.
Okay.
Yeah, that's right.
And then another sexual health issue is the big ED. That's the erectile dysfunction. And the erectile dysfunction, believe it or not, yes, is caused by heart disease. That falls under the cardiovascular disease. Yeah. It's caused by diabetes if your diabetes is not controlled. It is caused by certain medications. Okay. But you know, when you're listening to the commercial and the drug company make new medication and they're listing all of the side effects.
Yeah.
And they start to ramble all of the side effects. The only side effect that patients pay attention to, especially men, is if that medicine says ED.
Wow.
Once that side effect of that medication says ED, they will not take it. But just because that medicine says that it causes ED doesn't mean that you would develop that ED.
That's right.
Some people might, but again, that going to your doctor regularly comes into play. And I tell my patients, I tell them, I say, there are 4 people that you have to be honest with. When I meet my patient and we're getting to know each other, I tell them, I said, there's 4 people you have to be honest with.
Yeah.
The first person is whatever higher power you believe in.
Yeah.
Second person is yourself.
Mhm.
Third is your doctor. Because if you don't tell us what's going on, we are not psychics.
I know, right?
We are not magicians. We don't read minds. If you have a condition that is physical and is visible, I can see it. I can tell you what it is. But if you have something that is bothering you, internally, and you don't tell me the truth, I can't help you. And I tell my patient, the 4th person is your lawyer. Because if you don't tell your lawyer the truth, they cannot defend you properly.
That's true.
And I also tell my patient, I say, this relationship is 100% relationship. I will always give you my 50%. But you have to bring your 50% to make the pie 100% pie. And when I explain it to them like that, the light bulb, it goes on. Because I will always give you my 50%. I will always do what I'm supposed to do. And sometimes even go beyond and above. But if you give me 30% of the relationship, you will get 70%. If you give me 10% of the relationship, you will get 60% of that pie instead of 100%. And the remaining 40% is contingent on you.
That's right.
Because I will always do what I need to do for my patient. I will always do what I need to do for you.
So true.
So, it's a mutual relationship. The doctor or the provider has his or her responsibilities, and the patient has his or her responsibilities. Now, let me just, I know that the network was not too good. Let me just tell you how I got into the medical field.
Yeah, go ahead.
Nursing was never on my radar. Medicine was never on my radar because I was afraid of blood. I remember as a little girl back home, my grandmother, her brother used to be one of the top lawyers in Liberia. This man could get you, somebody could see you murdering a person, but he would get you off on technicality. That's how great he was. And I always wanted to be like him. And I remember one day we were sitting down and the topic choice was career choice. And when it was time for me to say what I wanted to do, I couldn't wait. I said, I wanted to be a lawyer just like my uncle. And I remember my grandmother vividly saying, no, lawyers don't go to heaven. Yes. And as a little girl, I wanted to go to heaven, so that stuck. I was crushed, but I knew lawyer was not it for me because I wanted to go to heaven. So fast forward, in 1989, she was here with us in the States, and she had to have open heart surgery. And during those, in the late 80s, open heart surgery was not as renowned and not as common as it is now. So she had a surgery in New Jersey, and I remember my aunt taking me to see her. My grandmother and I we were really, really close.
Oh.
She took me to see her, and when I got in the room, I saw she was on a ventilator. They had just brought her out of surgery, so she was on a ventilator. The machine was breathing for her. She was connected to all of these tubes, and all of these IV medications, and it really, really scared me. And I ran out of the room, crying. But the nurse that took care of her came outside to me, and she explained everything to me. She explained it in a way that a little teenage girl could understand.
Mm.
And when I went back in the room, I told myself that this was what I was going to do. This was going to be my way of giving back to society.
Amen.
Oh, sorry, she and I were very close, so it kind of hit home. And I told myself that I wanted to be just like that nurse. Yes, meaning that I wanted to be able to explain to my patients in layman's terms that they can understand me. Because, we as medical providers, we forget that we are talking to patients. These people have no medical background. They don't know the medical terminology, and we are shooting off these big medical terms to them.
So true.
So I'm not tooting my horn, but I try to be on that level with them when I'm explaining things to them. And you have to have a rapport with your patient. You have to get to know the entire being, not just the disease.
That's right.
You have to get to know them. You have to get to know their families. You have to know some of my patients when they come back, and I'll ask them, "Oh, so how's your sister doing?" And they are, they are shocked, because I remembered from the visit from 3 months that they told me, "Oh, my sister is not feeling well," or "My sister graduated," or so and so. If you have that rapport with your patient, they will tell you any and everything. But you don't want to make them feel as though they don't matter, or that they are just a patient. No, they are an individual. So you get to treat the patient holistically instead of just treating that disease process.
That's right.
Okay.
We have so
I
much.
talked about STDs and STIs.
Yeah. And prevention. How can you reduce the risk? We got so many.
How can you reduce the risk? Yeah.
I want you to know that we have a lot of questions in the comments. I mean, people are asking questions here. I don't think we can even exhaust this question, because we're not even done with the slides yet.
I know. I'm so sorry about the internet. Oh my goodness. Yes. So prevention is the key. Prevention, early detection is the key. Men, you have to go to your doctor. Don't put it off and say, "Oh, I'm not sick, so I don't need to go." You are paying for that insurance. Use it.
Use it. Make use.
This is your right. If you don't go, that it's like throwing all that thousands of dollars in the trash can every year. They take it out of your check every 2 weeks. So why not use it? Go, let them do your physical, let them do your labs. Because this is the only way we will find out if there is the disease process. And be honest with your doctor. Develop a relationship with your doctor and provider. Men, they partake in these risky lifestyle, meaning they want to drive fast, race car drivers, motorbike without helmets. Because they see it as a macho, hobby or macho activity. And we have to think about our safety as well.
That's right.
So I don't like the doctor should not be in your in should not be in your vocabulary, or it shouldn't be a part of your thought process, I should say. I have no time. Yes, you have time. You have time to go and get on your motorbike.
It's
Yes.
time to do all the party.
Yeah. Or they push it off and say, oh, I'll go when I'm older. I don't feel sick. I'm not sick. I don't get sick. I don't take medication. But you don't know what your blood pressure is. Again, blood pressure is the silent killer. So prevention is the key. It starts with you. It starts with us.
So true.
So we can pause there and
Yes, and take some questions.
take some questions.
Okay, we have a couple of them here. Let me start from all the way at the top or close to the top. Yeah. Somebody just made a comment and said, "Oh, my grandmother died of breast
And
cancer."
while you're looking, let me just add this thing in
Okay.
there about
This one.
for men, and
Yeah,
this
go
will
ahead.
be and that's what I was going to touch on. Self breast exam monthly module, or that little knot that's in your breast that wasn't there before, and then you can go and tell your doctor. Don't be scared. Don't hide it from your doctor, because if you don't tell us, we don't know.
Oh my God. Oh my God. She will be right back, my people that are watching us tonight. We are talking about men's health. She stressed some key points here tonight. The information is a lot. She said, make sure there are 4 things you need to be earnest with God, whoever you believe in. You need to be earnest with yourself. You need to be earnest with your doctor. You need to be earnest with your lawyer, because the people that need to help you, they need to know the condition. They need to know everything that is happening in order to give you the adequate health care that you need. So, and she said, make sure you make use of your insurance, because you are paying for it every month. Stop putting off, your treatment. Stop putting off your going to see your doctor or your physical. Stop putting it off, and do what you ought to do, because the older you get, the prone you are to a lot of killer diseases, especially in the place where our community eat all kinds of foods,
Yes.
all kinds of fatty foods and salty food, and we don't exercise. So you need to do your routine checkup. And we are back.
Yeah.
Fasia, welcome back. I know the internet has been something else tonight. Nevertheless, I'm enjoying this podcast, because there's a lot that I'm the devil is all I have. So there's a question on the screen. The person said, do you think most of the causes of these diseases is bad food habits?
Partly, yes, it's what you eat, but also it can be genetics. Parents had high blood pressure or diabetes, you are at risk of developing diabetes. And this is for women, if a woman has, or if a woman had gestational diabetes, meaning the diabetes you get when you're pregnant, she is at risk of getting diabetes, from age 40 on. If a woman gives birth, I know I'm going off the topic on women, but if a woman gives birth to a 10-pound baby or more, she is at risk for developing diabetes. If both men and women have skin tags, those little black little things that come, or we call it mole, on your body, on your face, you are at risk for developing diabetes. If the back of your neck, and that's for both men and women, if the back of your neck is like dark, it's black and velvety, we call that acanthamus nigricans, you are at risk for developing diabetes. The reason why that you get that velvety textured and it's really black on the back of your neck is because insulin is dumping in the cell. And that puts you at risk for diabetes. So most times you will see kids that are obese, neither be a female or a male, kids that are obese, you will see they will develop that dark stuff on the back of their neck. Down the line, they have to watch that high risk of developing diabetes.
Okay.
I hope that answered your question.
Yeah, we have another question here. What are the symptoms of cancer that can get me rushing to the doctor?
Great question.
Yeah.
So cancer, one of the telltale signs is if you are coughing up blood. If you're coughing up blood, I'm not saying where, you have a bad cold and you pop a blood vessel and you cough and just a little bit of streak of blood in your sputum. No, that's not what I'm talking about. I'm talking about you hacking up blood, bloody, your spit is bloody and not just a one-time thing. Second sign of cancer is unexplained weight loss. If you are not dieting, you are eating, regularly, but if you're coughing up blood, go see your doctor. If you're having shortness of breath, without any, if you're just sitting and you don't have any heart disease, you don't have any lung disease, and all of a sudden you just get short of breath, go to the doctor. Yes, those are the telltale signs of cancer. The unexplained weight loss, the coughing up blood, those two, they're major telltale signs of cancer. Now, you only start to develop the pain when it has gone beyond stage 1 into stage 2 and 3, and you didn't know.
Okay, we have another question here. This one, are you suggesting that men do a quarterly check for prostate cancer?
Well, this is what I do for my patient. When you come and see me, if you come and see me every 3 months, I check your prostate. That's just me. I'm proactive with my patients. Now, some doctors will do it, every 6 months if you go, or once a year, that's fine. But I do it every 3 months if you see me every 3 months routinely. Now, if you are healthy, and you're not on any medications, you are not, you don't have none of these comorbid conditions, meaning, you have more than one condition like high blood pressure, diabetes, congestive heart failure. If you don't have those that would cause you to go to the doctor every 3 months, then once a year is fine. I'm not saying that a healthy person should go to the doctor every 3 months just to have your prostate checked. So one might say, what are some of the signs and symptoms that you get if there's something wrong with your prostate?
Yeah.
So most times men will start to get up at night 2-3 times to go to the bathroom, to urinate. Now you might say, well, if they have diabetes, they pee a lot too. Yes. But when they do go to urinate at night, their stream is not as fluid, meaning the stream is when I say stream, the urine stream is not as normal. So I'm gonna put it in layman's term. If you are going to the bathroom to pee and your pee should go shh, okay? So you're peeing in the commode, it goes shh. But if you go to the bathroom and you pee, it goes shh. Then it stops and it dribble. Then it goes shh. stop and dribble. If there's interruption in your urine stream, in the urine flow, that's a problem. Does it mean that you have prostate cancer? No. It could mean that your prostate is getting enlarged. Okay. Also, let men know that your prostate is very, very important. You know why? Because your prostate is the one that fertilizes your sperm. So you ought to get it checked. If it has to be working to properly fertilize your sperm. I'm talking about fertility now.
You need for it to work.
Yes.
There's a need for it to be working.
Yes. So interruption in your urine stream is one of the signs and symptoms. Going to the bathroom at night, 3-4 times at night. If you don't have diabetes, waking up, going to the bathroom because you're not emptying your bladder properly. Another trick I tell my patients is that if you are going to do number 2, okay, and number 2 means, I would just say that you go and poo-poo. You're going to poop. If you're going to do number 2 and you are not constipated and you are sitting on the commode, when the bathroom is the most relaxed place you can be. You're sitting there, all your worries are gone. You're just there to do what you got to do out. But if you are sitting there to do number 2 and you are not constipated, but when that stool starts to come out, it begins to hurt, even though your stool is not hard. It's not, you're not constipated. You didn't strain to get it out, but it's gliding out and it's hurting. Tell your doctor that's a telltale sign. And a lot of people miss that. They just think, oh, I'm doing number 2, so it's coming out, it's hurting. No, it's not supposed to hurt if it's not too hard, if you're not constipated. Reason being is that stool, every time you do number 2, your stool glides right past the prostate. The prostate, again, is this little walnut-shaped organ that sits right there underneath the bladder and right above the urethra. Okay, so it sits right there in your rectum, and so when you're doing number 2, the stool glides right by it. It touches it. And if something is wrong, if it is swollen, it's going to hurt. A normal prostate should not be swollen. If it is swollen, there's another terminology that we give it is benign prostate hypertrophy, meaning enlargement of the prostate. That doesn't mean it's cancer, but there are things we can do, or there are medications we can give you that will help. So I hope that answers your question.
Yeah. And then we have another question here. When you were talking about sexual health, and this person said, wow, sleep with 1, sleep with 7. Any source of statistics?
Yes. Statistics says that if you sleep with 1 person, that means you slept with 7 other people that they've slept with, or if you sleep with 2 people, 2 different people, that means you slept with 21 people. If you sleep with 3 people in your lifetime, that means you've slept with 64 people. So for some of the men who think, oh man, having 5, 6 girlfriends, I don't know how to manage with that. It still boggles my mind how they can have more than 1. 1 is trouble enough, let alone 2, 3 at the same time. Yes, but that's another talk right there. So I know, right? if you sleep with 3 people, just know in your mind that you've slept with 64 other people. Yes.
Okay. And then the person said, let me put this on. We've time is fast spent. The person said, I have diabetes, but it doesn't stay in control. What should I do? You need to see a primary doctor. What should she do?
Are you on? Is the person on medication? If they have diabetes, now it depends on what type of diabetes they have. If it's type 1, Type 1 means that the pancreas is not creating any insulin at all. And most times that is genetic, meaning you're born with it. However, type 2 can turn into type 1 if it is not controlled. But most times if you have type 2, most people are born with it. But you can develop it, type 2 can turn into type 1. And then type 2, the pancreas is creating insulin, but it's not letting enough out. Okay? So if you're not taking your medications, your blood sugar is going to get high. And high blood sugar is just as worse as low blood sugar. High blood sugar, if your blood sugar gets in the 500 or more, you can go into a diabetic coma.
Yeah.
And that's not good.
Very let me put the next question on, please. The person is concerned, can erectile dysfunction be treated?
Yes, it can. Yes, it can. With the little blue pill. Okay? It can be treated with Viagra. It can be treated with Levitra. There are other, but most people knows the little blue pill, the Viagra. However, some guys and even younger guys think that it is macho or it is a male thing to take the pill just to have, a hard one, so they can say that they're a real man. You're causing yourself great disservice. Now you might not think that it is, but down the line it is. Let me explain what a Viagra does. Viagra takes the blood and rush it down to, this is an adult show, right? Because I want to be as candid as possible.
Yeah.
Okay. Yeah. So Viagra takes it rushes the blood to your penis. That's what gives a man an erection. Is when you get that euphoria, all of the blood rushes to your penis and you get an erection. That's what Viagra does. However, if my patient has uncontrolled high blood pressure, I'm not going to give you diabetes. I'm not going to give you a Viagra. No. And I'm candid with them. I'll tell them, I don't mind giving it to you, but your blood pressure has to be under control, because that's like putting fuel on the fire.
That's right.
If your blood pressure is already high and then I'm giving you something that's going to cause blood to rush, that's going to put your blood pressure more. It's going to put it higher more. And that can cause you to have stroke. And for those that are taking the blue pill, because people can buy these pills online without prescription from pharmacy online, and it will ship it to you. Yes. If you are taking this medication and you get an erection that will not go down for an hour, you better go to the emergency room. First of all, it's very painful. Number one.
Yeah.
You better go to the emergency room. If not, you can make yourself become sterile. And just for little boys, for those who have sons, I tell my teenage patients and their parents, I make sure the parents are in the room as well. I tell them that from age 14 and higher, the boys need to do self-testicular exam. And believe it or not, some of them will look at me, what's a testicle? Because all they know is that you're balls. So you have to speak those women seriously. Some adults don't, when you say testicles, they don't know what it is. That's what I mean by being, you have to be on that level with your patient.
Yeah.
You cannot keep shooting off, giving off all of these medical terms. No, because it goes in one ear and come out of the next. So boys 14 and up, I tell them once a month, when you're in the shower, use the first of the month, because not every month has 31 days. Not every February does not have 30 days. So if you're using the end of the month, then you won't do it on the same day. So I tell them use the first of the month. Every month has the first. And when they're in the shower, to check their balls, there should be 2 seeds. Those 2 seeds are your testicles. Feel them. When I tell them, they'll look at me like, I'm not going to touch myself. Well, do. Please do. I want you to get to know yourself. And
That's
even
right.
men can do it as well. Touch your balls. Make sure there's only 2 seeds. If you feel anything that feels like a frozen piece, tell your doctor or tell your parent if you are a teenager. Now, there's one more issue that happens from age 16. It's more prevalent from age 16 to 22. It is called testicular torsion. That's only with boys. And that is when the tubing that goes in the testicle that supplies the blood supply to your scrotum, that little sac, when it twists. Okay, so it would twist. It would twist like you twisting your clothes, and it is the worst pain they will ever have. Trust me, they won't hide it from you. They will let you know. But we as parents make sure that you take them to the ER, because there is a 6-hour window that if that testicular torsion is not surgically corrected, they can become sterile. So this is stuff to tell your teenage boys. Believe me, they will come and tell you, and they will be holding their balls because it is so painful. The worst pain that it can get. Yes.
Okay. We're sorry we out of time right now. This is just the intro to men's health. We're gonna be back here for part 2 of men's health. So bear with us. It has been a wonderful time, listening to all this information that is being passed across. And I believe there are a lot you learn here today. So thank you for watching us. Thank you for coming. We want to say thank you to Facia. I mean, this was wonderful. I just wanted us to go on and on, but we are limited by time. Even the internet could not stop us. The lagging in the internet could not stop us. And next time we will be back.
That was a liar. He did not win.
He did not.
I'll be happy to come back anytime. I love to teach, so anytime.
Oh, thank you so much. We appreciate that.
Anytime.
So we're going to be signing off now. I would just want to pray briefly for those that are sick tonight. And I declare the word of God, say by his stripes you are healed. So whatever the sickness, whatever the illness, we believe God is at work, and we believe that his word is touching you right now in the name of Jesus. Just believe and keep confessing the word. Pray for your loved ones. Those that are in a hospital, let the word of God locate them wherever they are and bring total healing and restoration in the name of Jesus. By his stripes you are healed. And the word of God says so. I believe it, and it is established in the name of Jesus. I believe tonight your home is healed. Your marriage is healed. That wayward child is healed. Whatever it is, God is in charge. Commit it into his hands, and he will perfect that which concerns your life to the glory of his name. You are healed tonight. It was wonderful having you. Continue. You can share this broadcast, and we will be back here next Thursday for Health Matters. Your health matters. Stay safe. Men, you want to live a little bit longer. There's statistics that says you have a shorter lifespan than women. So take up the challenge. Make sure you are doing your physical. Make sure you are taking your medication. Make sure you are praying above all else. That God will send healings in his ways for you. God bless you tonight. This has been a presentation by 45 City International Ministries, all the way here in Minnesota, USA. Thank you again, Facia. This was awesome. Beyond awesome. I don't know what the next word to give it again, but I really, really enjoyed myself. So we will be back next week. Yeah, God bless every one of you. And this is Health Matters.
It was a pleasure. Thank you. Thank you.
Oh,